On January 9, 2013, House File 5, a bipartisan bill to establish a health insurance exchange, was unveiled. The Health Insurance Exchange is an online marketplace where Minnesotans can compare and purchase health insurance. It is a key component of the Federal Patient Protection and Affordable Care Act.
This is, I believe, the most important moment in healthcare history in the United States since 1965, when we came up with Medicare and Medicaid.
I am here to support the worthy goals of this project. To tell you, I'm not a fan of the Affordable Care Act. I did not support it. I did not support the exchange. I was hoping it might change, but it did not. The Supreme Court decided it was fine, and the electorate decided that we would keep things on the track they're on. That being said, I come to you as a pragmatist, trying to make this the best it can be.
On January 22nd, House File 5 was presented to the House Commerce and Consumer Protection Finance and Policy Committee. One of the sticking points of the bill addressed was how a board of directors would be formed to oversee the new health care exchange. It was laid over for further consideration the following day.
If we don't do this, and I think just about everybody in the room knows this, if we fail to do this and do a state marketplace, the federal government will do it to us or for us, depending on your perspective.
I'm concerned that we're rushing through something that is basically going to change our entire insurance structure in the state of Minnesota. And I hope that we're not doing it just for the sake of getting through a timetable.
On February 6th, after being heard in the House Commerce and Consumer Protection Finance and Policy, Government Operations, and Civil Law Committees, House File 5 was heard in House Health and Human Services Policy Committee. The issue of the authority of the board was addressed.
We're entrusting a whole lot to this board with very little ability to follow up and find out, are they actually justifying the amount of money they're withholding, and how do we know that, and how do we as participants and elected officials who are trying to represent Minnesotans, how can we be certain that that is in fact what this board is going to do when we have very little oversight over them according to the bill as drafted?
Madam Chair and Representative Mack, I appreciate that concern. I share it. We actually have considerably more control over this potential board than we do over the PUC, for example, or the Minnesota Zoo Board, with all that's been built in.
On February 18th, House File 5 went before members of the House Health and Human Services Finance Committee. Several amendments were added to the bill, including one offered by Republican Representative Glenn Grunhagen, to ensure that the exchange could not require individuals and small businesses to purchase health insurance solely through the exchange.
What this amendment does, it just clarifies the continued operation of a private marketplace outside of the exchange. And it does so in several ways, but I think it's pretty self-explanatory. And it's to guarantee that the private marketplace will be separate from the exchange and will not be controlled by the exchange in any way.
The substance or the vast majority of the amendment, I have no problem with at all.
On February 25th, having been heard in 7 committees, the bill went to an important committee, the House Ways and Means. Representative Atkins explained how the health exchange would be funded.
As far as how it would be financed, a federally imposed version would be a guaranteed 3.5% premium withhold. There is no wiggle room in that. It would be 3.5% of the premium no matter what. So if your family is paying $1,000 a month for their health insurance through that exchange, $35 each month would go to pay for the operations of a federal exchange. In Minnesota, we think we can do it less expensively than that. In fact, while the bill provides for up to 3.5%, which is the federal figure, our modeling shows that we can probably do it in the neighborhood of about 2 to 2.5%. We're hoping maybe even less, but right now the model that we've run, MIT's health economist, Dr. Gruber, has indicated to us we think we can do it at about 2.25%. So on an apples-to-apples comparison with the federal government, ours would be about 55% cheaper than what the feds are proposing.
After its hearing in Ways and Means, House File 5 will go to the House floor, where a lively debate is expected. Open enrollment for the Health Insurance Exchange is slated for October 1st of this year. About 1.3 million Minnesotans are expected to use the exchange, including 300,000 who are now uninsured.